My name is Zaakirah Muhammad, and I am the Fractional Chief of Marketing and Events at Sanicle. I am passionate about ending period poverty because I am a polycystic ovarian syndrome warrior. What that means is I have had polycystic ovarian syndrome since I was first received my menstrual cycle at the ripe age of age 7. That means I've also had irregular menstrual cycles. Sometimes I've had very long menstrual cycles that last more than a week. Sometimes I've had menstrual cycles that have not shown its face in 11 months. This also contributes to extra hair all over my body, and cysts on my ovaries, in addition to the deepness in my voice. What you can do to raise awareness for all areas of period poverty is by having a conversation. A conversation starts with understanding that polycystic ovarian syndrome starts inside the body and can trickle out to the outside. It can affect your mental health and your reproductive health, and can also contribute toward the relationship that you do have. I am big on the tech industry, and growing up, in order to get the answers that I needed, I turned to Facebook groups, core groups, forums, and now summits. It takes you to be able to make that change and make the be of an impact and actually protect the woman, specifically the Black woman in your life, especially when it comes to the medical care. I am blessed to say that right now I have a doctor that's not going to just prescribe the immediate medication for me. Instead, I have doctors that are willing to listen to me. And also because I'm good at having all the apps that help me take extensive notes to keep regular journals about what's going on with my body, because I'm the one living inside of my body on a day-to-day basis, day in, day out. So being able to, one, be heard and be seen when it comes to going into and trusting the Western medical doctor facility, but also it starts with the community, starts with the partners and the guardians in your life and in my own life. So I challenge you to be committed to ending period poverty by being willing to have that tough conversation. Start by doing your research, start by having the conversations and listening to the podcast or reading the books that talk about the various autoimmune differences, whether it's polycystic ovarian syndrome, endometriosis, menorrhagia, or anything that you know that could be affecting the woman in your life. So visit sanicle.us to learn more about how you can continue to be an advocate for period poverty. I'm Zaakirah Muhammad, and I am the Chief of Marketing and Events at Sanicle.
Hi, I'm Carlisha Bradley, founder and executive director of Women Empowering Nations. I hate that I cannot be there with you today, but really share a deep connection to the purpose and priorities of this event today. Women Empowering Nations is an international nonprofit organization that supports young women of the African diaspora in accelerating their leadership journey through mentorship, exposure, and connections beyond borders. When I think about the topic that we're all gathered to discuss today, menstrual health, I know that it is such an important cause to not only learn more about, but to advocate for, because it impacts almost half of the world's population. And this is oftentimes a taboo topic that's been neglected for far too long. Today, I want to briefly share with you a few changes that we can make to ensure that menstrual health outcomes change. And the first one starts with education, providing comprehensive menstrual health education to both boys and girls from a young age, covering topics such as menstrual hygiene, reproductive health, and gender equality. Secondly is access to products. Menstrual products such as pads, tampons, menstrual cups, they should be affordable and accessible, regardless of income. That means that governments, NGOs, other organizations can provide subsidies or free products to those who cannot afford them. And we must advocate. We have to advocate for menstrual health at all levels of society, whether it's in government and policy, or even in public awareness campaigns and corporate responsibility. We cannot be silent about the issues that we're facing around the world. And lastly, it's about empowerment. Empowering girls and women to advocate for their own menstrual health through education, through support networks, and through the promotion of menstrual health as a human right. Through implementing these changes of education, of access, of advocacy, and empowerment, I believe that we can write a brighter future for girls and women around the world. I look forward to hearing about the amazing outcomes and conversations that you all will come to today. And I wish you all the best and that you have a wonderful conference.
Hi there, my name is Justin Harlan. I'm the Managing Director for Tulsa Remote, and I just wanted to take a quick second in the midst of my absence from today's conference, which I'm sorry that I couldn't be there to attend, to acknowledge and celebrate Chaste and Roxanne and all that they're doing with this important cause and important organization. We are proud of the two of you and grateful for the fact that you've chosen to root your organization and work in Tulsa, Oklahoma. At Tulsa Remote, we're incredibly committed to finding great people from all across the country who choose to do their remote work in Tulsa for at least a year, contributing to both the economy and the community. And this is a great example of what we want to see come to life. The Black Wall Street Times hosting this amazing event. So many people that I admire and I know have contributed to our success at Tulsa Remote as well, including our very own Dominique Clark, contributing to this conference. Just a really great example of somebody coming into town, ready to contribute, ready to make the city and state and world a better place, and then collaborating with locals to make that happen. The work at Sanicle is only getting started, and I'm excited to see where it goes from here. So I hope the conference goes great. We're proud of both Chaste and Roxanne and all that they're doing for the Tulsa community and this important issue. I hope everyone has a great day.